Next patient aged বয়স কত মা 27 age 27 diffuse enlargement of both lobes of the thyroid diffuse goiter কথাটা দেখি তোলো ঢোক গেল কমেছে আগের থেকে কতটা তাও 30 is remaining 70 is better ব্যথা হয় এটাতে নো পেইন এখন আর কি অসুবিধা হচ্ছে এটাতে অসুবিধা হয় না there is no complaint with the throat as much আর এমনি অন্যান্য অসুবিধা কি হচ্ছে এই গলাটা কত বছর ধরে আছে the goiter has been there since last 9 years no particular etiology for it started অলদারে কি হচ্ছে she also has hemorrhoids with pain and engorgement of the anus ব্যথা যন্ত্র কিরম ব্যথা হয় কি করলে কমে anal pain better by warm application রক্ত পড়ে না no bleeding hot application makes it better পায়খানা stool 2 days interval hard আর right sided backache for 2 weeks কখন হচ্ছে more on walking and more on standing কাশি আছে dry cough with dryness in her throat which comes frequently dry cough with dryness in her throat আর কিছু কি হয়
মানে অন্যরকম মানে পেটে ব্যথা তো আছে বুকের বাঁ সাইডে ব্যথা করছে আর বুক গলা পিঠ মানে গোটাটা
bloating with oppression in the chest and heaviness
যেন মনে হচ্ছে গলা থেকে এখন উঠেই যাচ্ছে তো খাওয়া দাওয়ার পরেই ওটা হয় মানে এমনি সময় গ্যাস তো সারাক্ষণ আছে কিন্তু খাওয়া দাওয়ার পর যেন
worse after meals I've been seeing her since 2023 we had started the case with Spongia Spongia was given in 30C Spongia was given in 30C over time we had gone to 10M with Spongia why Spongia goiter thyroid enlargements with dry cough and dryness in the throat that's the catch for Spongia dry cough and dryness in the throat with enlargement of the goiter that's the opening always remember for Spongia we had given initially thyroidinum she was chilly desire sweet didn't help much 30 200 1M thyroidinum was prescribed didn't help went to Spongia after that and she has been on Spongia since 2024 we had started with thyroidinum not much change with thyroidinum went to Spongia based on again the indication dryness in the throat dry cough with enlargement of the thyroid gland based on this indication try it for goiter you'll get very good results and always go to the higher and highest potencies with Spongia last prescription was Spongia 10M in December hair fall is also there not very marked generals so I'm not sharing that hemorrhoidal pain better by warmth let that go into clinical tips please arsenic muriatic acid, retania. Arsenic, muriatic acid, retania, as well as, let me check, arsenic, muriatic acid, retania, and Collinsonia I remember, but I will just check. Yeah, better from heat. Collinsonia. Arsenic, muriatic acid, retania, Collinsonia. Hemorrhoidal pain, better by warmth. Arsenicum, muriatic acid, retania, Collinsonia. Collinsonia is a very useful remedy with this picture. Hemorrhoidal pain, better by warmth in a constipated patient. And Collinsonia will help not only with the hemorrhoids, but also with the constipation. Not only with the hemorrhoids, but also with the constipation. But remember, Collinsonia's hemorrhoids is mostly bleeding hemorrhoids. Have a look in Borique, please, for Collinsonia. Correct. Introduction, pelvic and portal congestion resulting hemorrhoids and constipation, especially in females. That combination, women, hemorrhoids plus constipation. And many times Collinsonia patients will tell you, I feel like a heaviness in my back. Because of the portal congestion, I feel like a heaviness, weight in my back area. Introduction, last line, sense of weight and constriction. So heavy feeling in the back. Look in the rectum section, please. Most obstinate constipation with protruding hemorrhoids. She is passing stool 2 to 3 days interval. Constipation during pregnancy. Painful bleeding piles, rectum 5th line, painful bleeding piles. Generally bleeding hemorrhoids in Collinsonia. And even you can get alternate constipation and diarrhea as well. Look in the modality section, better by heat. Modality section, better by heat. So women, especially with slow circulation, portal congestion, brilliant for constipation in pregnancy, brilliant for hemorrhoids in pregnancy. You understand the circulation is even more slow during pregnancy. So constipation in pregnancy, hemorrhoids in pregnancy, with a heavy feeling in the back, some degree of bleeding, and they will tell you, I put some hot water, that makes me better. You can use it as an intercurrent in 30 and 200. I will use here in tincture today because the patient is doing well on Spongia. I won't want to interfere with its action. Collinsonia tincture, I am prescribing today. You see the common name, stone root. So that's the hardness of the stool reflected in the name as well. Stone root, is it not stone root? Yeah. Collinsonia in tincture today, and I am not interfering with the action of Spongia. She is doing better, and hopefully that will continue its action on the goiter. Collinsonia in tincture, 10 drops, একটা ফোঁটা ওষুধ লিখে দিচ্ছি, 10 ফোঁটা 3 বার করে খাবে, মলদারের সমস্যাটা ভালো থাকলে বন্ধ রাখবে। 10 drops in a cup of water. হ্যাঁ লিখেছি, রিপোর্ট দেখাও। Half cup of water 8 hourly. When the pain or the constipation is worse, stop when better. TSH is more on the low side, 0.2. Sorry.
If the patients come with hypothyroid, you give them a separate prescription for that?
Sorry, if patients come with?
Hypothyroid, like they have like hemorrhoids or cough or something.
No, give the constitutional remedy. As her goiter is 70% better, so we are not doing anything with Spongia. We are still sticking with Spongia. And hemorrhoids is more like a recent issue. Hopefully Collinsonia will take care of it. But the constitutional remedy will respond well with the hypothyroid.
But if they're constantly hypothyroid for
If on medication, you can give organopathics. If not, constitutional remedy will have the answer. There is organopathic, have a look in boric, fucus, F-U-C-U-S, fucus vesiculosus. That works well for obesity with hypothyroid.
That will be in potency or
Tincture, fucus in tincture. If you know they are on high doses of thyroxine and hypothyroid levels are still high, you can gradually wean it off, put it on fucus. Smell is very bad.
Can't you give thyroid?
Thyroidinum is a very deep acting polycrest. Don't prescribe it indiscriminately on just based on thyroid symptoms. I don't do it.
She's not on medication.
No, she's not on medication. Have a look in boric, fucus vesiculosus, obesity with hypothyroid. That works well for fucus. Then niche dekhiyo diye debe.
What is non-toxic goiter?
Sorry,
What is non-toxic goiter?
non-toxic goiter.
Toxic goiter is when there is too much thyroid.
It's goiter with a patient with goiter, like the thyroid enlargement, can be hypothyroid as well as hyperthyroid, right? So toxic goiter is generally for hyperthyroid, right? So when it's non-toxic goiter, so it's mostly hypothyroid with the goiter enlargement. If you find anywhere written toxic goiter, that means the patient has features of hyperthyroidism with the goiter enlargement. Fucus vesiculosus, you see it's prepared from kelp, and kelp is very good for thyroid enlargements, very good source of iodine as well. Introduction, remedy for obesity and non-toxic goiter. You will see the last line, thyroid enlargement in obese subjects. In tincture, it works really well.
You've never given him potency and gone up on this one?
Not really, no. I hope you got the points of Collinsonia again. I repeat Collinsonia. We are giving Collinsonia in tincture. Constipation with hemorrhoids, where the hemorrhoidal pain is better by heat. Generally, it works well for women during pregnancy. Due to the portal stasis, you have constipation as well as hemorrhoids to develop during pregnancy. And many times you will have a heaviness in the anal area or in the back, with a sensation of weight in the rectum. This combination works really well for Collinsonia. You can give it in the 30C, 200C. You can give it in tincture like we did here today as well.